Plastic, present in so many aspects of modern life, can easily turn into a source of microorganisms such as fungi, viruses, and bacteria due to its porous surface. Your cell phone case has a bacterial load greater than 30 times that of a public restroom. In everyday objects, this might not pose a threat, but in the case of a medical device such as a 3D printed prosthesis or orthosis in direct contact with the patient's skin, could cause serious skin infections because of microorganisms lodged in it, hindering further treatment and raising the costs involved. This is the case for 40% of said patients. It was this number that pushed us to think and develop a way to solve the problem of bacterial load in plastics, especially those used in the 3D printing industry, once and for all. After months of research, we turned our attention to an emblematic material for our country, which would help us find a solution. Copper, one of the strongest bactericidal elements in the world, according to the EPA. Copper nanoparticles embedded into the material's structure free copper ions that break the microorganisms' membranes and even alter their DNA, eliminating them completely and keeping the material free of pathogens. We're excited to imagine the global impact that a material like this could have in everyday life, in 3D printed objects for all uses in all areas. A world free of bacteria. Amputees will benefit from this new generation of antibacterial materials. Industries and people will be positively impacted by this development. Industries such as veterinary and medical devices, food packaging, kitchen utensils, toys. We want to make plastic a clean material. We want to start the antibacterial 3D printing revolution. We need you to turn this project into a reality. Our material will soon be available. Sign up at copper3d.com so you can be one of the first people to try our revolutionary material. Help us start the antibacterial 3D printing revolution today.
Hi, my name is Arsha Gracio and I'm the founder of Upnews. I'm here to talk to you about a pandemic that's playing out in slow motion. And no, it's not COVID. It's called pollution. 90% of the world, according to the WHO, breathes in air that's unfit, it's toxic. Each of us take about 220,000 breaths a day, and that's about 10,000 liters of toxic air that's entering our lungs every single day. And that is the reason why chronic lung disease is the third largest killer of people globally. It affects 9 out of 10 people living in urban areas, and oftentimes it's irreversible, and it disproportionately impacts women, children, and the elderly. Unfortunately, we can't choose the air we breathe, and therefore the only thing that's left to us is to be able to understand the impact this is happening on our lung systems and to be able to prevent a crisis before it sets in. And that really is our mission with Upnews. We're here to provide everybody everywhere with a tool that allows them to screen their lungs for early symptoms of disease and to take the appropriate action to be able to decrease the impact on their lives. With just the microphone on your phone, your voice and your breath, we measure clinical parameters like spirometry, which is the gold standard to identify diseases such as chronic obstructive pulmonary disease, asthma, and cystic fibrosis. We also track other lung conditions such as coughing, dyspnea, also known as breathlessness, and changes in your voice, which could point to symptoms that are related to changes from your baseline. The data is collected and then graded according to the level of risk, and that risk changes depending on your sex. And therefore, we've built in the ability to adapt our technology to the unique physiological, genetic, and biological needs of women, which unfortunately is not the case with any technology on the market today. The reason why we're different is because we're not dependent on hardware. We are able to operate on many smartphone models because we're not dependent on high-end devices as yet. And more importantly, we're easily scalable because all it takes is an app download. My team is highly experienced in the development of mobile technologies. We all come from technology backgrounds, and we've partnered up with state-of-the-art institutions that are focused on developing solutions for pulmonary health, for leading hospitals in the UK today and also respiratory centers of excellence. We are in the process of raising our seed round of 1.5 million, and we would be keen to have a discussion and change the face of respiratory health in the world, especially for women. Thank you.
Hello, I'm Erica Brodnock, co-founder and CEO of Cami. We're the virtual support system for every parental journey. So a bit about me. I'm a mum of 5, an MBA, a PhD in psychological behavioural science, and Sky News' resident parenting expert. I've previously scaled an EdTech startup to more than 8 million users and have been able to build a team with the perfect mix of skills for success in this area. My co-founders and I are flanked by a team of business, behaviour change, perinatal and wellbeing specialists and psychologists who will support our platform users as we train algorithms that enable us to scale their expertise.
I'm Jacob, the COO, and I spent the last 10 years in operations and finance roles in the investment and fintech industries. And I'd like to introduce you to Fiona, Jodie, and Neil. So they come from different backgrounds, cultures, and socioeconomic classes. The one thing uniting them is that thinking about having a child is turning their world upside down. Whether it's their first or their third child, the transition into parenthood is tough. And for something with no formal training, we're expected to balance work and parenting with less support than ever before. And the impact of this is significant. In the UK alone, 2 million people become parents each year, and 1 in 3 suffer from mental ill health, costing their employers £8.2 billion. And that's not looking at the impact on the children, their education, and society at large. And whilst research has shown there's pockets of good content in the bump and baby industries, the current resources fail to provide the personalisation, trust, and reassurance that modern parents need to feel more confident and less overwhelmed. To effectively address this problem, our user-centered design process draws on parents from different backgrounds, cultures, and socioeconomic classes and directly responds to their needs.
Dr. Helen Yannikadakis is Cami's chief scientist, and she specialises in the machine learning for natural language processing that's enabling us to build a truly novel product. Those most impacted by the issues that Jacob described tend to be vulnerable parents unable to afford extra support. Black women fall squarely into this category, having been found to be 5 times more likely to die in childbirth than their white counterparts. This is largely attributable to a lack of personalised care throughout their pregnancies. Our vision is to revolutionise the transition to parenthood while ensuring that all parents are included. Our annotation taxonomies, as well as our algorithms, are being devised by experts of all ethnicities to ensure that biases are minimised. Over the next 5 years, our AI as peer solution will democratise access to high-quality specialist support for modern parents like Fiona, Jodie, and Neil, positively impacting the lives of millions as they transition through pregnancy, parenting, and beyond. Our total UK addressable market is worth £3.1 billion, and we're starting with the IT and comms industries, where 86% of firms are willing to spend on wellbeing, and more than 74% of their employees are stressed.
Hi, my name is Miles McAuliffe and I'm the founder of Medflow. Back in 2016, I undertook work experience at my local hospital. It's here my passion for healthcare began, but I was also able to witness firsthand the size and complexity of hospitals. With hundreds of staff and thousands of medical equipment, this creates a huge challenge when it comes to managing equipment, resulting in staff spending time having to find equipment instead of doing what they do best, caring for patients. With minimal data when it comes to equipment usage and maintenance, this often leads to budgets being spent on equipment they don't need or will not fully utilise. With over 1,500 hospitals in the UK alone and having spoke to a number of NHS staff, these inherent problems stem much further than just my local hospital. This is where Medflow comes in, a real-time asset and usage tracking system for hospitals. With each piece of equipment given its own tag known as an ID that connects to Bluetooth receivers across the hospital, the exact real-time location as well as device usage and maintenance is stored in one easy-to-use software application that's accessible by all members of staff. Of course, we're not alone in this space and have a number of competitors, especially in the US, but we have some key advantages over these. A dashboard specifically designed for the healthcare market, a cloud and Bluetooth-based technology with rollout across entire hospitals in a number of days with very minimal disturbance. With a specific focus on the UK market initially, we can monopolise this market first. Medflow will operate two main business models, an annual or monthly fee for use of the software and hardware in each hospital, and secondly, an initial fee for installation of the system. With the global RTLS and digital healthcare sectors expected to be worth a combined $620 billion by 2026, as well as the issues the NHS is facing such as staffing and financial issues, this is a great time for a system like Medflow to be brought to market. With myself graduating in June this year with a degree in biomedical engineering, as well as having previous business experience, I'll be working on this business full-time after my studies to help bring Medflow to life. For the launch of Medflow, we'll be operating a 5-stage plan. Stage 1 involves the creation of an MVP and hiring of the initial founding team. Stage 2 and 3 will be a trial phase in partner with a selected hospital, followed by a full-scale hospital rollout. Stage 4 will then work with a small number of hospitals and trusts to improve the product and gather data before Stage 5 with the long-term goal of rolling out across the entire country and beyond. Stage 1, this is where we need your help. We're seeking to raise up for the development of our MVP, which will be used in product demonstrations in hospitals and to investors, but most importantly will act as a foundation to further develop Medflow. Thank you for listening, and if you have any questions, please do get in contact with us. Thank you.
Hi, I'm Pip, and I'm going to tell you how I bounced back from severe anxiety to change how we approach mental health. It's a well-known fact that 1 in 4 people suffer from a mental health condition. But I want you to imagine for a moment a world where we could fast forward in time to identify the people who will suffer from mental health conditions. Then, rewind and treat them with preventative medicine. Wouldn't that be amazing? Well, we kind of can, and I want to show you how. Psychologist Adam Grant recently had an article published in the New York Times highlighting the neglected middle child of mental health. He shared that people most at risk of severe mental health conditions such as depression and anxiety aren't the ones who are suffering today. These people are languishing. He describes mental health as a spectrum, with depression on one end and flourishing on the other. Languishing is the void in the middle, feeling joyless, aimless, and lacking in motivation. People feel this way because they don't have a clear goal to work towards, and frankly, this is a product of our society. Just think about it. From the age of 5 up to 21, we're in systems that give us clear structure of what to achieve. Success is clearly defined and rewarded in the form of grades. Your next step is obvious. It's the next school year, or university, an apprenticeship, or a job. But as you get older, this structure fades away. Hard work no longer guarantees success, and promotions get increasingly hard to achieve. We are not trained as individuals to define what success means in our lives and set goals to get there. So when we run out of goals that have been handed to us, what next? These people need a life coach, and they can get one for the price of a cup of coffee each month. When I was at my lowest, I decided to resume a lockdown hobby I'd started, a professional life coaching qualification. What I realised was that life coaching is insanely simple. Coaches aren't these mystical beings with all the answers. They simply provide the right frameworks and questions to help people get there on their own. So, if it's really this simple and effective, why should this industry be restricted to the most affluent people who can afford it? Why can't it be delivered on an app, at a fraction of the cost? For a small monthly subscription, you can have a life coach in your pocket. You'll be guided through the same frameworks and exercises that people pay hundreds, even thousands of pounds for. Your experience will be uniquely tailored to you, getting to the core of your values and priorities in life. So, I guess you're wondering what my goal is. I'm on a mission to prevent mental health disorders caused by languishing. I'm determined to help people identify their most fulfilled life and lay out the roadmap for it. And I won't stop until we get there.
My name is Alexis Abayami and I'm the founder of UCycleSync, an app helping menstruators eliminate PMS naturally. We provide personalized recommendations on nutrition, exercise and task management to help menstruators tackle the root cause of PMS, which is hormonal imbalance. Women Health Scarves have research that shows that 90% of menstruators suffer from PMS. That's 90% of people who fear their body month after month for 35 to 40 years. I was once given that sentence. My doctors told me that having cramps was completely normal and the only option I had were painkillers or hormonal birth controls for 40 years of my life. And I thought, how can this be? How is this possible? I'm so glad I did not listen and I found an alternative. And using lifestyle changes, we can eliminate PMS together. UCycleSync is on a mission to help 10,000 menstruators eliminate PMS and leverage the power of their menstrual cycle this year. We currently have an MVP on the App Store and Google Play Store. The Grocery List app that helps people pick groceries that are supportive to each stage of their menstrual cycle is 99p and we have 180 downloads. In June, we're moving to the new version of the app, which will create a holistic program to take people from PMS to no PMS. And this will have a free section and a $9.99 subscription. Our focus right now is selling these subscription packages to workplaces as part of their wellbeing program. We've currently signed on 2 companies, Different and Zeason, and together they're going to have 20 subscriptions for 3 months. We're very excited, and so please pick us to pitch at London Tech Week. Thank you.
Hello, my name is Marcelo Vera. I am the commercial manager of Veterinary Histopathology Center. We are a diagnostic lab specialist in histopathology, advanced pathology, and disease diagnostics. One of the most growing industries around the world is aquaculture. It is generating more than $232,000 million per year, corresponding to a production of 80 million tons. Aquaculture is one of the industries which is most affected by diseases, because in the aquatic environment it is more difficult to avoid pathogens. BIC, born from the necessity of the industry, where one of the most important risk factors is mortalities by fish diseases. This is producing important productive losses and stopping the development of aquaculture projects. In BIC, we work with animal health, giving solutions for diagnostics and prevention in the main production species in aquaculture. With advanced histopathology, we help companies to take better productive decisions to make sustainable industry, decreasing mortalities and decreasing the use of chemicals and antibiotics. Our services have the capacity to analyze in an integral way the condition of the productive groups, analyzing the cause and effects of different agents like genetics, environmental, nutritional, toxics, etc., and promoting preventive sanitary strategies. We have developed the quantitative digital pathology, offering to our customers quantitative diagnostics with the help of a professional network of international specialists, making the service highly scalable. Currently, we are working in the development of artificial intelligence for diagnostics, which will allow us to have more capacity for analysis and to reduce the time response for our customers. BIC has been using a strategy of diversification and expansion with high success. In 2021, we expect to reach more than $1 million in sales, and by 2023, we expect to go over $2 million in sales due to our internationalization strategy, which is allowing us to sign contracts with big players in the international aquaculture industry. Our executive team is conformed by the CEO, Gabriela Vera, the technical manager, Carlos Sandoval, the project manager, Matias Vera, and the commercial manager, myself, Marcelo Vera. Our international director is Dr. Hugh Ferguson from Scotland, which is one of the most recognized aquaculture pathologists worldwide. BIC has more than 30 employees and many specialist advisors around the world. In 2021, we started operations in Scotland, creating BIC Limited, and we are closing deals with important aquaculture companies in Europe. We strongly believe that we can help aquaculture health status in Europe, improving sustainability and animal welfare. Thank you.